Now we will start studying about breathing circuit. Till now we have seen we have got a cylinder which has got a very high pressure, and from there it is gradually getting reduced through intermediate and then reaching the common gas outlet which has got a low pressure at the end, and it is to this common gas outlet you connect the breathing circuit. Now this breathing circuit goes and reach the front of the patient. So you understood now the difference between common gas outlet, this is a common gas outlet, and this is the, imagine this is a patient and patient has got an endotracheal tube. So this is a patient with tube and this is a common gas outlet of the Boyle's machine. Boyle's machine. Now here what you get at the common gas outlet, we get oxygen, we get nitrous oxide, and we also get the volatile agents at the common gas outlet. Everything will come together at the common gas outlet. Now the next aim is to connect the gases coming out of the common gas outlet to the patient. This is achieved by what is known as breathing circuit. So this green portion indicates the breathing circuit. We are going to study about this breathing circuit, the connecting link between the common gas outlet and the endotracheal tube of the patient. Now common breathing circuit has been classified into different names and different groups, and finally it has evoked a lot of confusions. So finally now we have managed to classify it in a little more acceptable manner, easy to remember. So we will put it in three classifications. One as open circuit, and the second is closed circuit, and something in between as semi-open and semi-closed. Both semi-open and semi-closed can be considered as a same modality or a same circuit. The only difference is in the flows you keep. So if you keep a higher flow, it becomes a semi-open, and you keep a low flow, it becomes semi-closed circuit. So don't worry, just learn a semi-closed circuit. So we are going to learn about open circuit, semi-closed circuit, and closed circuit. Now how do you classify them? What is the feature that differentiate these? The essential feature that differentiates between these circuits, open, semi-open or semi-closed, and the closed circuit is that, number one, presence of a carbon dioxide absorbent, and number two, presence of rebreathing. Rebreathing means whatever amount of air that is given out has been rebreathed or taken in for the next inspiration. So depending on these two features, you can classify every breathing circuit into open, semi-closed and closed system. Now just imagine what happens in open circuit. Now what is open circuit? That is the one which you usually see in your movies, films, etc., where a person will be standing or lying, suddenly somebody come from behind, pour some chloroform into the handkerchief, hold it from behind, and the patient become unconscious. So this is a classical example of open circuit. Now why do I say that? Because there is no carbon dioxide absorbent. Whatever carbon dioxide which is generated by the patient is given to the atmosphere. There is nothing to absorb. Number two, there is zero rebreathing, because whatever air is taken in from the atmosphere is completely given back to the atmosphere. You don't rebreathe. So there is zero rebreathing. There is no rebreathing in open circuit, and there is carbon dioxide absorbent. Is it needed or not? There is no carbon dioxide absorbent as well, because no rebreathing, no carbon dioxide absorbent. Now go to the other extreme. Here there is complete rebreathing, and there you need a carbon dioxide absorbent. What happens is, here the common gas outlet gives oxygen. The patient here takes in oxygen, do his metabolic activity and give out carbon dioxide, which is again going back to the machine. So this is complete rebreathing. There is no exhaling of air. So there is complete, the same air keeps on rotating. So there should be an integral presence of an agent or a component which actually takes this carbon dioxide, purify it and give back as only oxygen. So the carbon dioxide enter here and oxygen is given back. This is what is known